Well, hi everyone. Thank you for being here today. This is the Regional LPC meeting. There's a few people who won't be able to make it, so that's also why I'm recording. I did send the agenda. I ended up adding one more thing after, but I will share my screen now. Actually, so we'll start with introductions, if that's okay with everyone. I'll stop sharing just so we can all see each other. I think most of us know each other, but just in case, I'll start. I'm Daniela Arias. I'm the program coordinator at the Hub. I will kind of be pretty much taking over the LPC and focusing more on that, as well as Caitlin. As you can see, we've divided up the 14 towns. She'll go to 7. I'll focus on the other 7. And then we come together for things like the regional meeting and the application and things. So I'll pass it along to Caitlin.
Morning, everyone. I'm Caitlin Comets, previously an AmeriCorps Prevention Corps member, but as of last Friday, I'm lucky enough to be continuing working with the Hub full-time as a program coordinator. Thank you. I'm really excited. This is my second day in the office and it's surreal, but it's really nice. And like Daniela said, I'll be helping out with the LPCs as well as leading the CAC initiatives. So I'm here to assist in any way, and I'm excited to be continuing to work with all of you. Thank you. I'll pass it on to the next person I see, and that's Kathy.
Good morning, everybody. Kathy Hazlett, Program Director, Coalition Coordinator for Fairfield Cares Community Coalition, and recent DFC grantee. Yeah.
Welcome aboard the crazy train, Kathy. I'll introduce myself since I just.
Go ahead.
Oh, I'll keep going. So I'm Kirsten. I'm from TPOD Trumbull's Prevention Partnership. James.
James Olson. I'm the prevention coordinator for the Stratford Partnership for Youth and Families. Margaret.
Hi guys, Margaret Watt, Prevention Director at Positive Directions, here for the Norwalk. No, I'm not. I'm here. I don't know. We work with Norwalk and Westport. I'm the LPC for Westport. If Diamond doesn't make it, I'll also be the LPC for Norwalk today.
I'm Ellen Brzezowski. I'm from Greenwich Together Prevention Coordinator.
My dogs are representing Norwalk.
I'm Stacey Walker, the Education and Program Coordinator at New Canaan Cares, and New Canaan Cares is the LPC for New Canaan, and so we're responsible for the New Canaan Coalition.
I know you're muted.
Yeah.
Hi, Ina Anderson. You guys call me Lisa sometimes, I think, but anyway, it's Ina Elisa. So I am with Bridgeport United Coalitions in the city of Bridgeport.
And I think Kristen's the last one.
Hi, everyone. Sorry, had to get to a spot where I could stop. I'm Kristen McCarthy-Vahey. I am the current, soon to be immediate past co-chair of Fairfield Cares Community Coalition.
Great. Thank you, everyone. Okay, and Caitlin introduced herself. We are very excited to have her. Next, we'll just go over some due date reminders. The LPC application is due next Friday, October 15th by noon. I know some people have sent them over, but as sooner the better. It needs to be by noon though. Demographic forms are due December 15th. And then we will be doing our mid-year check-in the week of January 24th. Last year was kind of a lot, having doing it all in one day and giving everyone 15-minute time slots. So we have learned from that, and we'll create a new Google Doc, and we're actually going to do it throughout the week. So that way there's more time and it's not rushed, and we can take the time to focus on whatever needs to be discussed. Does anyone have any questions or anything about that? Okay, can't see everyone, so just unmute yourself and jump in. Next, I'd like to focus on the vaping initiative and kind of just talk about how vaping is affecting your community now that we're moving into the post-pandemic life. With the LPC application, vaping is still the focus. It will be, it was for 5 years, so I believe there's 4 or 3 years left. Does anyone want to discuss anything that they're seeing in their town or that has been brought up in coalition meetings around vaping?
I could say that in Westport, one thing that's been interesting is the Youth Services Bureau has been telling us that they're seeing more vaping and they're hearing more reports of vaping in the schools now that everyone's back. And at the same time, at our coalition meeting this week, the SRO said they're not getting any reports and they're not seeing it. So I thought that was interesting. But the teen awareness group is just kind of getting going for the year. There's going to be a meeting Monday night, so I want to see what they're thinking about vaping in terms of what they're seeing. But I would also say that both through the youth survey we did in the spring in Westport and anecdotal reports, it seems like the bulk of what kids are vaping is THC. So our focus is more on the marijuana aspect of it. At the same time in Norwalk, we did a similar survey. In Norwalk, the kids who were vaping, which was still pretty, in both towns, it was a pretty low percentage in terms of our survey. But in Norwalk, the kids who were vaping were like vaping, they were equally vaping marijuana and nicotine, but in Westport, it was more marijuana than nicotine.
I just wanted to echo that, Margaret. So we had our SRO up in our office yesterday from our high school, and he's saying the same thing. They're seeing an influx, an increase in vaping. Kids are doing it out in their cars, you know, in the parking lots, obviously in the school. And he's same thing. He's noticing it's THC as well.
Mm-hmm.
Yeah, I think in Greenwich, when we did our youth survey in February, we saw a decrease in vaping, but we attributed that to COVID because kids weren't actually in school as much and maybe didn't have access to it or wasn't being seen or reported as much. I don't know yet this year about it. I think some schools were still in the kind of the honeymoon phases. Kids were sort of happy to be back, and they haven't reported too much as of yet, but I have a youth coalition meeting in the middle of October. So I hopefully will get some more feedback from them about it. And we're going to work on some initiatives around that. We're going to do some environmental scans around just how tobacco is placed in convenience stores and where it's placed and that kind of thing. So, so hopefully that will give us some information too. But we did have some parent focus groups over the summer about the survey results. And one of the parents actually is a clerk in a convenience store. And she told me that kids will come into the convenience store with someone who is 21, but there's a group of kids with him that are younger than 21. And so they're having that person buy the vape products for them. But she said, you know, what they don't realize is that because they're all together, they have to card all of them. So, so I think she was one of the more conscientious retailers, but so it's interesting, though, that they're pretty blatantly having older kids buy the products for them. They know the law. They just are trying to get around it that way. So,
yeah, I'm sure the other retailers aren't doing what that retailer is doing.
We actually had a compliance check in June in Greenwich for tobacco products, and 6 out of the 10 retailers failed. So, and they were all fined. They were all fined $300. So hopefully they'll get their act together, but we'll see.
Norwalk just fined 4 different retailers, I think, last weekend. But I think like all of us doing whatever kind of environmental scans we can. I know everyone's probably thinking about it, but if that's possible, I mean, in Norwalk, at least there are just all these new vape shops, hookah shops, like everything everywhere, all this advertising for Delta 8, like they're just ready to start selling marijuana like July 1st, you know?
Yeah.
Building new businesses to be ready for it.
I think
Well, and I
it's,
think too, what our SRO is saying is not only that, obviously, we know kids can go on Amazon or the dark web, right? Where you have access to that and it's a whole different world. I guess you have to use something special to get onto the dark web, but these kids know how to do it and they're accessing, all the drugs, the vapes. It's just easy for them to get it. He was saying you don't even have to go out of town anymore. It's just all at their fingertips.
yeah, I would say with regard to Fairfield, it's pretty much ditto what everybody else is saying. I did have a conversation with a mom a few weeks ago whose son was able to purchase, and he's only 16, nicotine vapes from a store on Black Rock Turnpike. She did call the police to inform the police. Police did visit the store, but the police unfortunately were under the impression that the age to sell was 18 and not 21. So
Oh my God.
we found out that we need to do some education for the police to be sure that they understand that vapes are included in the tobacco law, and that is in fact 21.
That's nuts.
Wow.
And I understand the police department recently did do compliance checks, but I don't know if that was for alcohol or tobacco. I've tried to connect with the department to get some data on that, and I haven't heard back, but hopefully we'll hear soon.
Kathy, I think that was alcohol.
In Trumbull, we've been talking a lot about the fact that pre-filled vapes are excluded from potency limits in the marijuana bill that just passed. So we're starting now to talk about, what's going to happen when, retail starts up next year and we start seeing these things and pre-filled vapes are excluded, and we know they can be up at like 90–95%. So as everyone else is saying, the kids that are getting caught with vapes, a lot of them are getting caught with THC in them. So it's a little worrying that the pre-filled vape cartridges are going to be exempt. So I think that's where we've been focusing a lot of our discussion on educating people about that.
Kristen, is that something that anyone's talked about introducing more a revision or amendment to the legislation about?
It's funny you say that, Margaret. I have not heard that, but I was thought the same thing. I'm like, oh, that's one thing we could certainly do.
All right, Tag, you're it.
Yeah, that would be great. I have no idea why though they were excluded to begin with, but that would be fantastic.
Money. It's always why they're excluded. It's always
Yeah,
about
it's just
business
weird
and
that
money.
it's like the
I'm so
one
cynical,
thing.
I doubt, apologies. I'll get on camera as soon as I can, but I don't think it was about money, and there's usually some strange reason, and I will try and do some digging as to why, and then, yeah, see if we can move forward on that.
I mean, I wonder if it could have just been that they're thinking those are things you can buy on the web and they could come from anywhere, and how do we regulate it if it's not coming from out of state, and so that they were just like exempted, but all that does is create that market. While we're on vaping, we are going to pilot test that in the air graphic novel based prevention curriculum. Did anyone else get trained in it, or has anyone used it? Ellen, did you already use it?
No, I just gotten trained in it. So, it's always tough to sort of try to get into the schools to use it. But we are working with Vicki from Southern Connecticut State University, and she has hired a student intern to do some vaping curriculum education for mostly after school programs. So we're going to try to pilot it at our Boys and Girls Club. And I don't know if she'll use that or not, but they're definitely going to come down to Greenwich at some point and do at least 1 or 2 sessions on vaping prevention, because we're trying to target the 7th and 8th graders, because we know that that's where it could start before they get to high school. So,
Yeah, I got trained in the air as well, and have ordered materials just so that I can have a conversation with our health education coordinator, for lack of a better term, Lori Mediotti for Fairfield Public Schools, to share the information with her, and have the Boys and Girls Club in mind too, and perhaps even the Fairfield YMCA for the middle school kids, you know, as different populations or different ways to implement the curriculum. So, but I thought I'd first work with Lori, see what she thinks of it, and then go from there.
Okay, great. Thank you for sharing. Anything else before we move on?
Just wanted to add that, you know, one of the conversations that we've been having, because we're in our coalitions, is that with, you know, now that vape, so it was really interesting that Kathy said the Fairfield cops actually didn't even realize what the age was for vaping when that happened 2 full years ago. But so now that at least all the legal age is the same for alcohol, tobacco, and marijuana, we're thinking that it's an opportunity to work with the towns to create new signage that's like kind of global signage, and then we can put whatever else we want on there, like QR codes to the website or whatever. But that there can be some kind of campaigns around legal age, around resources that you can access, you know, at beaches and parks and at schools and whatever, just whether it's like lawn signs that are more awareness, but just even what's the law, what's the age, just creating signs that fit all the different products and getting them out there. Because I don't know about you guys, but Norwalk in particular, I mean, the cops are they've been so demoralized in every meeting that we've had. They're just like, you smell marijuana everywhere, and everybody's using it, and they're driving and they're doing this, that, and the other thing. And they don't feel like there's any support they really kind of, even before the law passed, they were like, what can you do? It's at the beach, it's at the parks, it's everywhere. And we're like, well, it's actually not allowed to be everywhere in public spaces. So that's one thing we're talking about.
just a quick question for everybody about, you know, the Let's Mention Prevention campaign. Do you know does anyone know if they're going to be doing anything on marijuana? I know they've done alcohol and vaping, and I don't know if they do something on vaping marijuana. I mean, I may just contact them myself to see if they could do something, because we have money in our DFC grant and hopefully in the LPC grant that we get if I ever get the application in. So I just wondered if anybody's heard about that, because that's such a great campaign, and I think that would be a good way to get the word out about marijuana too.
It's in progress now.
Oh, good. Okay. Excellent. Thanks, Chris.
I can't remember how many, there's other people on here that are involved as well. Like James, Margaret, I think we had about maybe, could we have as many as 10 communities? We have quite a bit. I know we have, you know, the West Haven, Bethany, Milford, Orange, that whole group, Stratford, Westport, Durham, Middlefield, Trumbull, obviously. Oh, there's more. Wolcott is now involved.
Did you say Wallingford?
There's a bunch. Wallingford. Yeah, there's a bunch. So that's in progress now. It'll take a few months. I would assume it would start rolling out probably the beginning of 2022. But we're working on that. I think we're thinking about doing some social media posts, some maybe 3 short videos that can be shared, some billboard artwork, so that, you know, people who have billboards and have the money to do that could maybe do that, but you can also use that for if you want to do banners or posters, things like that. There's lawn signs. So yeah, it's in progress right now.
Okay, so other communities could maybe, you know, get some, borrow or buy some of those materials and have them, what's the word? You know, customized to their prevention council. Okay, great. Thank you so much.
That would be awesome. Okay, I'm gonna move on to Soar now. I'm actually gonna let Caitlin give a quick update on Narcan and the hub.
Yeah, so we are going to be continuing offering Narcan, free virtual Narcan training. So they are going to continue to be virtual for, we haven't really visited returning in person at all, but so they're going to continue to be virtual. Still continue to offer twice a month Narcan trainings to the community at large, as well as if anyone or any groups, organizations want a Narcan training specific to them, we can also facilitate that. So we'll be continuing that. And we've been also continuing to hand out Narcan kits for anybody who needs it. We've handed out quite a lot in the past few months, so that's been really great. So you can always reach out to us if you need any assistance with that.
We also had the Narcan van come down to Bridgeport in the Stratford area, and we had 43 people trained that day. Yeah, so that was great.
I'll just add that Liberation also has a van now, the Liberation Wellness Van. I don't know how far it goes in the state, but it definitely is in the Greenwich, Stamford, Norwalk area. And they have Narcan on that van that they will train people, when they park in wherever they park, and give out Narcan as well. So.
The Liberations van came to our vigil, Paul's vigil.
Oh, they did. Oh, great.
Yeah,
Great.
so that was great to see. Yeah.
Yeah. Yeah, terrific there. It's a great bunch of people who run that too, so.
Speaking of vigils, there were vigils held throughout the region in Fairfield, New Canaan, Stratford, and Bridgeport, which is awesome. I would just like to take the time to remind you guys to send us your flyers and everything so we can promote it as well. Also as soon as possible. That way we can put it on our social media, in our newsletter, send out an email. We could even attach the flyer, to our website and stuff. We just noticed that we were getting things like very last minute. So of course, the earlier the better, because we always want to promote what you guys are doing. I would also like to remind you that Drug Take Back Day is October 23rd. I'm not sure if anyone has any plans yet. If they have any flyers, again, the same thing, so we can promote what's going on in the region.
Fairfield, we don't have any flyers yet, but I've met with the police, and we're getting youth involved in that day, and we'll be there. We'll be promoting it.
Great.
Yeah, the Greenwich Police usually, even though we have a Dropbox 24/7, they usually set up a table that day and do promote it. I haven't gotten anything yet, but I'll check in with them.
Perfect. Thank you. And then I wanted to just take some time to talk about the state SOAR deliverables. And I wanted to kind of just open the floor to see if there's anything you guys would want to be seen as a deliverable. I know they've been pretty much the same for, I don't even know how long now. I've only been here a year, but I believe it's been longer than that. Just so if you have any feedback or anything, now would be the time. Or if you think of anything, email me as well so we can get that back to them.
I think generally, if the deliverables, I think like conceptually, they have been micromanaging some of it, right? So they'll be like, here are like 4 deliverables you have to have, and then here are 3 more, but you have to do 2 of them. So you really can only opt out of 1. And if they can give a little more flexibility, like if it's still at that level, that would be worthwhile having that discussion at the resource links meeting. If I think putting counterfeit drugs into the mix would be really great. That new website, by the way, that you guys all worked on was fantastic. But like that's really a big issue. And I think we all keep hearing about benzos being such a huge issue, which are not opioids, but like, so just if there was any way to use that money to address benzos and counterfeit drugs, which may or may not be counterfeit opioids, that would be really helpful. And And if they could clarify kind of like is the state going to be generating any new stuff that we, you know how like in the past it's been like you have to use Live Loud, you have to promote, change the script. So if there's going to be a new statewide campaign or anything that's going to be something we all have to promote, then what's the availability to participate in developing that? Or could we at the regional level do something if we want to, if that makes more sense, you know, customizing something but sharing it among us? Those are some thoughts.
Yeah, okay.
Not that they always
I
listen.
think my other feedback, and I mean, it's pertaining to, you know, the LPC grant. I know Danielle and I have talked about this, and I wasn't involved in the SOR grant application last time. But you know, to be limited on the amount of money that can be used to pay people, you know, to that 15%, which was the LPC limit. You know, when so much is done through social media, it's important that you have the ability to pay the person who's responsible for social media. So, because a lot of this stuff doesn't happen without the person behind it. So I think to give flexibility on how money is spent would be very helpful and not limit it to, you know, an unrealistic amount.
Well, and there's that inconsistency too, right? Where the LPC grant typically says how much you can spend on a staff person or overhead or whatever. And then the SOR one really didn't specify that, which, you know, so then you're like, wait, is it also $500 or is it something else? So just being clear about that, but totally agree with Kathy. I know we've all provided that feedback before, but Daniela, are they still, like, where are we in the process of the next SOR? Like, are they working on it? Do they know when the money's going to come out?
I have not heard anything. So as soon as we find out, of course, we'll let you know, but they're just requesting the demographic forms today, by today. They want them ASAP. So I'm assuming soon, maybe in a few weeks, but I will double check and follow up with you guys.
I would say one thing when you send that in, I mean, you know, because this last year, like Diamond, who's I see is here, so Diamond and Riney from Fairfield and I and Kevin all worked with 3 towns on the same kind of SOR grant. And we just went like, look, part of what we're doing is building our own capacity to deliver new programs. We're buying supplies. Like during COVID, what's the reality of like how many people we're going to actually interact with out there in the community? So, you know, I don't know, I'm assuming a lot of, you know, just like with the LPC grant, like no one was getting as many people online as you would get in person at events, right? So that's just going to be what they're going to see in the SOR.
Yeah.
Well, and also the demographic forms are, it's an odd way to report on the grant, because if you looked at those forms, it looks like we did nothing. Like, oh, we had like, oh, you know, maybe we hit like 100 people. But there was so much, like we actually have done, we did more with that grant this year with the You Think You Know CT.org thing. But like it's not reflected like in the way that we're reporting on these things. And when I look at my budget for that, nothing on my budget really matches a lot of what I'm reporting on the demo form, because there I'm only reporting the like Margaret was saying, a lot is like buying supplies. Well, I'm not going to put like, oh, these are the supplies I bought, because I don't need to report on that. So the reporting is really strange. I wish there was a more accurate way to reflect what we were really doing.
Mm-hmm.
Maybe our activities and what we bought and why, and giving some justification to that, as opposed to like, here's these weird demo forms. The reporting is weird to me.
But Daniela, do you want to tell them a little bit about how the data goes into impact, and there's like, that's why it is the way it is? And
Sure. So I actually have not done anything with impact. Giovanna's still doing that, but I know that it is very specific that those are the things that they want, and it goes in that way, and there isn't room really for anything else. Am I correct, Margaret? I don't think
It's a horrible database. Those forms are completely based on the data that goes into a garbage in, nothing out system. It's not even one of, if you guys remember the term garbage in, garbage out for crappy data systems, you can't even get information out. But it's not, Demas says it's a national system, which I find incredibly hard to believe. But they have always said that they can't edit it and they can't change it, and they're required to send the data up like this. And I think it's really based on, at some level, someone can just aggregate and add together, like, if we all said we reached, like, Ellen reached 5,000 people and James reached 10 and whatever, I think it's just created to generate, like, adding numbers together. And at probably some federal level, they're like, prevention money hit this many millions of people, but it is not useful for planning or real reporting or analysis. And when I was still at the hub, we couldn't get anything out. We could not get any reports back out. It was crazy. But so I don't think the forms are going to change.
Yeah, unfortunately.
Well, at least
So,
I know I don't have
Margaret-
to put too much thought into them. If they're just, I mean, I spend a lot of time, like, but maybe I'm spending too much time on them if it's really just like garbage in, nothing out. That's a shame. But I get it. They want to be able to say, we gave this much money and we hit this many people. I understand it. I just don't think it's necessarily the best way.
Can I just ask, Margaret, you just said you don't think this is going to change. It sounds like this is a significant systems issue, but it's pretty significant, right?
Mm-hmm. Yeah.
And this might be, I'm not suggesting this group take this on, but from a policy standpoint, this might be something that I would really happily partner with. Obviously there are only so many things that I can champion, but this one is significant, and it would be working with our federal partners as well, because I mean, we talk about this all the time, how we use data to drive decisions, and for programming, but also policymakers at every level. And at the state level, we passed legislation about how we're collecting data, to look at health inequities. Obviously, this is part of that and connected to that. So, except for we have our different silos that we do that in. Anyway, I would love to talk more offline about this and look at the long term. I'm going to say fight. I hate to use that word, but the long term fight on this.
It would be amazing if that could ultimately change, because I can tell you this is something that goes back years. Everybody's always said how, like on the LPC level, honestly, like filling out the forms and stuff is time consuming and annoying and feels sort of frustrating and pointless. But you guys don't even have any idea of like how much, like when Ray was at the hub, it was like basically half her job was just inputting this stuff. Like you guys know how underfunded the system is at every single level, and you're investing in our time, the hub's time, other people's time to put this stuff into a system, because it's even kludgy. The database, the interface is kludgy. So it's extremely inefficient, and then nothing out of it.
Yes, it is very frustrating, but thank you for your feedback. We'll compile it, together and hope for the best, but I appreciate it.
It's so awesome to have Kristen here as a legislator who's like, should I take this on? like I bet the RVHOs will circle back to you on that, Kristen.
Yes. Okay. Next on the agenda is the priority report. So the hub completed the priority report in June. It is about 70 pages. It is lengthy, but there is a ton of great information and stats. It is available on our website, so you can either print it out or view it digitally. For that, with your With the LPC application, the first initiative is vaping, but now with the extra COVID fund, you can pick up to 2 other local substances. So with that, we do recommend you looking at the prevention and recommendations, just so when you're filling out your application, you can circle back and show why you chose that for your town. We also completed a PowerPoint, which we can share at your LPC meetings, or we can do something regionally, just so we can go over what was actually found in the priority report. Does anyone have any questions about the local substance or anything like that? Has there been any difficulty in deciding? I know some towns were able to do surveys, others were not. They've spoken to other stakeholders.
Daniela, I'm sorry, just where do you download the prior? I mean, I know you've emailed it out before, but where do you download it on the website? Oh, on data, probably.
Yes.
Yeah, there, I'm sorry. Yep, clicked on the wrong thing.
Okay, no, that's fine. I'll bring up the website. Let me see. Oops.
I put it in the chat, Daniela.
Oh, perfect. Thank you. Oh no, how do my screen? Oh, there we go. We've also made some updates to our website. Let me see. We also completed infographics of the 9 EPI profiles that are also available on our website. Okay, so here on our website under data, you can download here the complete profile, as well as here are all of the infographics, and you can go back previously to our the other priority reports and previous infographics. We have added under wellness an LGBTQIA+ resources page with a ton of resources and information here.
That's incredible, by the way. I just was on that yesterday. I didn't realize you had added that. That is so chock full. I love that. While we're looking at this, the reason I was on this was I was looking for that need help poster that you see all over the place. And you have it on your site somewhere. But do you guys all know what I mean? The one that says like need help, and then it has, we were wondering, does one of those exist, or can we get one that exists that's more specifically targeting kids? Because I know like on that, it's like if you need help with housing or, things like that. But a poster that we could all use and maybe like put in our, like in the bathrooms in our high schools, or
So we
could do one. I mean, we could certainly create one, that one. Like we could create one ourselves, but we thought, wouldn't it be cool if like that existed, but all of the resources were focused on resources that youth could access?
So we have one, we have a couple different things that we have through Turning Point CT. Also like in Norwalk, we actually made a slideshow that was shown in all the health classes last year, or on all the homerooms last year. It was like, here are the free emotional supports for youth that are available to you. And some of them were specific to Norwalk, because it was like, you got your school-based health centers, you got your teen talk counselors, which not everyone has. And then it was like, here are the, warm lines and so forth. And so that is downloadable off the Norwalk Partnership website. But the, I can actually email you guys the one that Turning Point CT has. It's focused on hotlines and crisis lines. Like it's got kids in crisis in there. It's got national, it's got LGBTQ specific, and then it has like Connecticut specific. Mostly it's basically crisis lines and the young adult warm line. And then it's from turningpointct.org, because that's also, the local group or the state-based peer support group that we want people to know about. So I can email that to you guys. That's going to be mailed to all schools to put out. We've asked them to put them in all the bathrooms so everyone can take pictures of them and so forth. So if I can take this opportunity to ask you guys for your support. Every year, turningpointct.org does a mailing to all the high schools, middle schools, and colleges in the state, and we send them a bunch of resources about about the project so that young people can, find resources and sort of feel like they're not alone. And there's a lot of different things they can do. We send flyers about the podcast, and the students can participate in them. They can listen to them. They're on different topics. They're 2 a month. Now we have this new resource flyer. I mean, the staff just turned over, and I was just interviewing people for the new positions. And like every time this happens, I'm interviewing like teens and young adults that are usually local in this area. And I'm always like, so when did you find out about turningpointct.org? And did you see posters in your school or college? And it's almost always no. They're like, no, I heard about it because I saw the job posting, or my mom told me because she's a behavioral health worker. And literally this even happens in schools right here in Region 1, where I'm like, but Jesus, I've like personally handed people printouts, at meetings. So I want to say, like, we'd really appreciate you guys supporting just in LPC meetings. Like some of the Turning Point CT people can come and talk briefly at a LPC meeting, if that's a good opportunity for the stakeholders in your town to know about this, state-sponsored, peer-created resources by and for teens and young adults. It's all around mental health and substance use. It's right here in Connecticut. The staff can come and talk at, like they do resource tables. They talk at their speakers at events, talking about their personal journeys, etc. And I have like zillions of I think they're probably like 18 by, 12 by 18 posters, like that are already printed about turningpointct.org that we couldn't really, they're too big to mail. And we would have normally been giving them out at events, but during COVID, we couldn't. So if anyone here, because you guys are local, if you would distribute them around your town, I will get them to you. So just wanted to say that. And I think Allie has all of you guys, or Kaylee, on a weekly email, but if we are, because we know that all the social media of Turning Point CT are really aimed at young people, all the program, so people who work with young people like you guys, or who work with people who work with young people, there's a weekly email blast that's now going out on Fridays from Kaylee Marcarell, who's the new project coordinator. And it's just every week, if you want to get on that email list, you can either forward it or only use it when you want to, but it'll be like, here's the new content we posted this week. So this week there was like an ADHD awareness post by someone who like really got into the description of, what it's like to live with that. There's posts about, having a good therapist. There's new podcasts coming out, which are opportunities for young people to participate in a podcast. Like it's telling you what's coming, etc.
Margaret, who's the new coordinator of
Kaylee Marcarell. So I'll put her email in here if you want to be added to the list. If you're not getting that.
Thanks. And then, so is there going to be a mailing to schools coming up, or?
Yeah, so normally we do it in the summer, so it's there for the beginning of the fiscal, but our grant is delayed right now, so it's going to go out in the near future. But I may even be able to upload right now.
I was just thinking, just let us know when that mailing has gone out, and then we can follow up with the principals and people at the school, say, hey, you've got this stuff coming. It's good stuff. Please put it up in your schools, distribute, etc.
Yeah, that would be great.
Sorry, Mark, I was going to say the same thing. If you could just heads up, please, when that goes out. And I'm sorry, Margaret, does that go to only the high schools, did you say, or middle schools as well?
I think it's middle through college.
Well, okay.
Yeah, I mean, it's definitely high schools and colleges, but I'm pretty sure we had middle schools in there.
Okay.
Yeah.
Super. Yeah, we could definitely follow up on that. Thank you.
That would be great. And one thing too is we're going to have, they're going to make a little kind of updated quick video where you'll just hear a couple of them talking about, what's the project and how could students get involved, or how could you invite us to do something, and what is there. So when we have that, I would love it if you guys would consider either having them literally genuinely zoom into an LPC meeting and say, this is who we are and what we have, or if not, maybe just show that video or circulate it to your LPCs. Because I would say there's just a ton of good content on the website and the various social media that has all been developed by young people in Connecticut. And when young people find it, they're always like, oh, I wish I had seen that when I was in high school and I was struggling. So, you know, that's why it's there, and please help get the word out.
Margaret, I'm going to reach out to you and to Kaylee. I'm in the beginnings of organizing Freshman Forum, and
Yeah.
it would be great to have someone from Turning Point CT, because it's going to be in person, speak and
Yep.
share the resources. So I think that would be great. So
That'd be
I'll
great.
connect with
Yeah.
you.
And Allie's obviously spoken at it before because she's even from Fairfield, but we have in person. That's cool that you're going to be able to do in person. That's great. Yes.
Yeah.
Margaret, we have our survey presentation on Tuesday night. It's it's virtual, but I would love, you know, I'm in the process of making a handout of resources. So if you can get me that Turning Point CT resource list, I'll you know, make it more local to Greenwich. But this is a good way to get out that information too about Turning Point CT.
Awesome. Thank you.
Great. Thank you for sharing, Margaret.
I think also, Daniela, if we want to just kind of address that we had some technical issues with the forms on our website in requesting materials. It just got really complicated when individuals were using our form to request our free materials. It would go to different email addresses. Some we would just miss, but we have resolved it, and we've been on top of it and tracking it every day. So we apologize if there was a delay or we didn't get back to you if you did request free materials. You should have heard back from us by now. If you haven't, let us know. But we are tracking it very closely and back on top of it when it comes to all the technology and stuff. So thank you for your patience. And yeah, we'll be able to do that whenever anybody needs any sort of materials.
Yes, thank you, Caitlin. We have also updated our products page as well. The resource guides have been flying off the shelves, which is great. So we just got another large order in, and we're getting all of those together. And here you can go on anytime, request whatever you want. And like Caitlin said, we will respond daily. We also have added an events page to our website. So here you will see today was the Regional Local Prevention Council meeting. You do not have to register for this, only because there's not so many of us, and I know who everyone is, so I'll be emailing you guys, and I sent a calendar invite. But we have a lunch and learn coming up, Catch My Breath, October 20th, so you can go there to register. The Zoom link will be sent to you. It'll just ask you for some things, who you're affiliated with and such, our Narcan trainings, the CAC meetings, and so on. So as the events come in, we'll post it here instead of sending out, like, for example, on the flyer, the Zoom link. We're going to direct everyone back here to this events page. We also have the private LPC page, which we have been updating as well. So the most recent information is the LPC application. We also, again, we have the contact list, which I will actually be sending out in the follow-up email just for you guys to review to make sure that your information is correct. So please just review it. And if there's any edits, just email me back, and then we'll update that, and I'll send out a final version to everyone when it's completed. We have the permanent list of awareness days and months, applying for the LPC grant, the DEMIS data reporting forms, the demographic forms, and then we also have the different campaigns. So the vaping campaign, Darien, our Darien alcohol awareness campaign, and so on. And if there's anything specific you would like to be added to this page, please just let me know and we'll add it. Does anyone have any questions or anything about our website?
With that events page, actually, are you going to get rid of the calendar, or are you going to have both?
I believe we're going to keep both. And we will do again another calendar specifically in May for Mental Health Awareness Month. The events page is just easier for us in keeping track of who registered and having everyone's emails and things like that. But we'll keep the calendar updated for everyone else.
Okay, awesome.
Speaking of the calendar, thank you. Actually, when you do have events and things, you can send us a calendar invite to the info email, and then that way we can add it to that calendar. And I'm not sure if everyone now on Google Calendar, you can actually upload attachments. So you can upload flyers and things right there. So when you go to click on it on the calendar, the flyer and everything will pop right up. But if you invite us to all of that, we can add it to our calendar that way. Okay. Next on the agenda, I wanted to bring up SAM, the Smart Approaches to Marijuana, a possible presentation for Region 1. I'll pull up the email and to see what your thoughts are on that. So SAM can do a presentation based off of their annual impact report on lessons learned in legalized states. It's about a 45-minute presentation, and there can be 15 to 20 minutes after for a Q&A. The only thing is that the presentation typically costs around $5,000. So yes, it is expensive. So we just wanted to see if there was any feedback on if we wanted to pool dollars and do it as a region and have kind of, you know, a regional thing or anything like that. We could ask other people such as like Newport Academy or Mountainside or possibly another private treatment provider to sponsor it, but just wanted to see your thoughts since marijuana and the legalization and everything has been a topic amongst everyone.
Would it be virtual or in person, or that's not determined yet?
That is?
It's Sonia, sorry, Sonia staff.
Question. Hi, good question. Let me see here.
I mean, Weston, while you're looking, is so small that any opportunity we can, you know, pool resources or contribute. And our challenge is just engagement and turnout. And so if there's a regional presentation and we can promote it that way, I'm curious. I know there was something, I can't remember exactly where it may have been, but it was an in-person event that was broadly promoted and other communities were invited to attend. So I was just curious.
Okay. I will definitely double check and see, because if it is regional, it may be difficult for everyone to get to that place and determine where that place is, but I will double check because I do not see that here. So I will email them.
Okay, awesome. Thank you, Danielle. Thank you.
Yeah, thank you.
Daniela, for their presentation, because I've listened to several in the past, and I'm familiar with the report that they do, which is actually very, very helpful. But would they have the ability to tailor it to the Connecticut law so that they can speak to gaps for those of us that feel there are gaps in that law or flaws in that law, that, you know, areas of advocacy that we could be addressing, tools to address those areas. You know, I don't want something that's so generic that it's not going to be as helpful to me as if it were more tailored to our situation in Connecticut. I think that would really be helpful. You know, there are quite a few areas, in my opinion, that need to be revisited, shall we say.
Yes, I completely agree. I think it would make the most sense if they could focus on Connecticut.
And we could even provide them, you know, with a list. Could you please include in your presentation these areas of the Connecticut law that would be helpful in developing advocacy for those specific topics.
Yes. That would be great.
Yeah.
I will.
I mean, I completely agree with everything that Kathy said. I think like it's a lot of money to invest in having them come to present. So I think what's going to matter is if you guys are able to get someone to sponsor it and bring them to speak. Part of what matters is making it really, really local, making it really timely, because when the next legislative session comes up, we want to be ready with like, what are the things and who are the legislators who are putting in amendments that we all want. And yeah, so it has to be like timely as well as actionable and local. If they would take so long to present, or it happens like in the middle of the session, it's sort of too late. You know, but then in that case, then maybe there's someone else that comes and does the presentation or something. I also want to mention a few of us went to a presentation around the Project Echo marijuana kind of learning collaborative a few months ago, and I'm in the Connecticut team for that. And I guess Danielle, you also shared some of the materials. But so Project Echo is a New England, where it's a learning collaborative, and the New England group has people from all 6 states. The Connecticut team has Carol Meredith from Demas Prevention. It has the Region 4 RBHAO. It has Connecticut Clearinghouse, me and a couple of like LPC folks from other parts of the state. And we get to hear what they're calling didactic presentations every month by someone who's a marijuana expert from somewhere in the country. And then there's also a like learning lab presentation that's optional. And then we put together case studies from each of our states and get to discuss and debate and provide feedback to one another on what's going on in our state. And we can share all of those materials. I mean, everything that's recorded can be shared out, because I confirmed that with them, and then was going to share some of it out. And Daniela, you had already gotten it and done that, but that's going to be going on every month for like 6 months or more. So I also am wondering, we've only had one didactic so far, but if we get really good presenters there, they might not cost $5,000.
Yes.
Danielle, does it need to be regional? Because frankly, I think the issues are statewide. I mean, it might be helpful to make this, you know, available to the other coalitions in the other regions, because it's not just specific to Region 1. I think you know, all prevention coalitions could benefit from a presentation from Sam that could be specific to the Connecticut cannabis law, and perhaps there's money from all the RBHOs to then kick in to cover the cost, which would make it less, you know, burdensome on any one RBHO.
Yes. Yeah, that's a great idea. Definitely look into it and see what the other RBHAOs think, and if it's possible to open it up to everyone.
Can I ask, while we're on this topic, does anyone have, has anyone had a really super dynamic speaker aimed at parents around marijuana? Because I know that that's like something that we've all been talking about, in everybody that I've been talking to is like, who's the best speaker? And people are sending around like emails and like, how about this guy from Long Island? And I'm like, no, he's just like an old grumpy kind of white guy. Like, that's not going to work for this population that we want. So the key word is dynamic and engaging. Who's your best speaker on marijuana?
You know, she's not specifically on marijuana, but Alicia Farrell. We had her
100%.
speak, last spring, May. She did a parent thing. It was more about communication with your kids, and then she brought in marijuana, vaping, alcohol, that kind of stuff. I just think she's got such a great presentation style, and she's a little pricey, but she's good. She does to give a lot of tip sheets and things like that. But you know, some of the specific marijuana speakers are so technical, or they get into the science of it, and
It's
nobody
too much.
cares.
Yeah.
Nobody cares.
Right. And they're
So,
like, the police control this and that, and the, you know, trends over time, like too
Yeah.
much for, you know, yeah.
yeah, she spoke directly to parents, you know, really giving them sort of actionable tips that they could use. And again, it was a lot about communication
Mhm.
with your kids. So anyway, I like her very
That's
much.
good. Yeah, and her name is one of the ones that did come up, and she has some of her videos, not on marijuana specifically, but that you can even watch on her website.
And actually, the one she did for us is on our website. So if you wanted to look at that one from May, it's on under, I think it's under events. I have to look, but I'm pretty sure that's where it is.
And Ellen, when you say pricey, how much are we talking?
I believe she was 900 for that. I believe I can, you know, because it was virtual, but I think she's still, that was her price when she did in person. I know she spoke for CARES the year before that in person, and I believe it was around that price.
Margaret, I don't think we spent that much. I can check how much she charged us for our virtual event. I don't recall it being 900. That seems pretty high. I do recall her saying, though, that she would be willing to work with coalitions based on what they were willing to pay, because she knew that some had DFC and some didn't. I can try to find it. I don't know if I'll be successful, but if I find it,
That's a really good ballpark, though. Thank you. That's good.
Sorry, do you mind funneling that information through Daniela so that it can go out to everyone, please? That would be awesome. Thank you. Not to add to Daniela's plate, sorry.
Don't worry, happy to do it.
Wait, it looks like Stacy, are you talking and we can't hear you?
I sometimes talk to myself, and so what I was saying to myself, I forgot you could see me, was maybe if we're all using her, she'll give us a discounted group rate.
Hmm.
Yeah.
Well, and if we're all using her, if a lot of us are using her virtually, there can be like a combined, like she's speaking to these 3 towns at the same time.
Yeah, I know I shared that pretty widely when she spoke in May because it was virtual, and we had over 100 people, and I don't think they were all from Greenwich. So,
Mhm.
Or maybe we could partner, you know, and bring it to obviously everyone and anyone and advertise it. So just a thought.
And nobody has anybody else besides Alicia Farrell. I know Melissa and John Davio are doing a talk on marijuana for, is it the Youth Services Bureaus, Kirsten, next week?
yes.
I was
She
asking
does.
her if that's
Melissa has
something
a
that
really
they
great
would.
presentation,
Yeah.
but I mean, hers is geared more about like what the law, like a general overview. We had, what's her name? Liz Jorgensen do a virtual on marijuana. She's good. She's Liz Jorgensen. You know, she's so kooky, which we love. It's a whole different vibe than Alicia Farrell. I think it would depend on what you were going for, but she was great too.
How much did that one cost?
I really shouldn't admit this out loud, but we never received an invoice, so
Ooh.
it was on her this time. She is another one who asks you sort of, you know, based on your funding, what you're willing to pay.
but I think Liz too also works for or contracts with Newport Academy. So if you go through Newport Academy, they may pay her. So.
Oh, that's great. A great suggestion.
Does anyone have any videos of Liz that I could see? I haven't seen her. Or is she on YouTube anywhere?
Right on her
website,
site,
maybe.
Yeah, she's got a bunch of blogs that you can listen to and videos that she's shared.
She's Insight Counseling. Yeah.
Kirsten, would Melissa come visit other places nearby?
Definitely. Reach out. She'd be more than happy to do it.
We've used her a fair amount in Fairfield. She's hysterical. She really engages the parents. She's fun and very knowledgeable. So I recommend Liz.
Okay, great. Anyone else think of anything? If you think of anything after, email me and I'll share it with everyone.
I'm gonna just throw something in the chat while we're talking about resources, and it's a link to a movie trailer that I've watched a couple times.
You're muted.
Margaret, you're muted.
Sorry, it was the dogs. Just while we're talking about resources, I just put a link in the chat to the trailer for the film Don't Wait. That's like a parenting video around like why you should talk to your kids. And I was wondering if anyone had seen that or shown that. I'm planning to, you can get a $10 like individual thing. So I'm gonna watch it and see, but apparently you can stream it for a month for $500. So it looked like a good kind of overall parents, you should be talking to your kids about substances. Has anyone seen this one? Okay. Well, then I will let you know if we do use it and what we think.
Last thing on the agenda was just upcoming awareness days and months. October is Wellness Month. Is anyone doing anything for that?
Fresh check day at NCC.
Great.
We're trying to do some, Diamond, are the screenings going to happen in the schools? Check up from your neck up.
So we're still working on that. I know me and you had spoke about certain days and trying to do something bigger, but definitely something's gonna happen in the school-based health center.
Awesome. The hub will also be at NCC on Thursday.
What did you say?
The hub will also be at NCC on Thursday. Okay. Well, if anyone's doing anything, again, just sharing the flyers with us and we'll get those out, or anything, social media, all that. I will send the list again in the follow-up email for the upcoming days and months. Yeah, and then now I guess just announcements. I did receive something from Ingrid. She couldn't be here today, but she has a gambling awareness update. She said to email her if anyone is interested in learning more about the quarterly gambling meetings. There are many ways to get involved. The remaining Zoom meetings for 2021 and 2022 are the second Tuesday in December, March, and June from 2 to 4 p.m. Also, you can email her to let her know if your LPC would like a presentation on Gaming 101. There have also been many questions about sports betting and online gambling, so she is actually organizing a lunch and learn on that. So if you have any questions or anything with that, feel free to email and reach out to Ingrid.
But Daniela, those dates for the regional meetings, those are already on that hub calendar, right? Or are they different? Okay.
Yes.
I attended that first of 3 series on the gaming and gambling training. It was excellent. So Kelly Lepard, and I can't remember the other woman, they both did an excellent job. So I highly recommend attending 2 and 3 and listening to the recording of 1. It was really good.
I attended that as well, and it was awesome. I learned a lot. Does anyone else have any announcements?
We're having a youth mental health first aid training in November in Greenwich at the YMCA. Once I get the flyer, I will, share it with that through the hub. So
Ellen, are you doing that? Are you doing that in person?
it is in person right
So are
now.
But so then you're able to have like 30 people in the training.
Like, I think we limited it to 20 or 25. That's
Okay.
the limit. So, yeah, it's Denise Quayle and Kim Lissack from Kids in Crisis, who are mental health youth first aid trainers, will be providing it. I think it's 9 to 3, and lunch is provided by Greenwich Hospital. So it's their event, but we're helping with it. So
We're also hosting one on October 23rd in person. So that's coming right up.
where's that going to be, James?
Here in Stratford,
Okay.
Community Services.
We did, our clinical director, Angelina, is a mental health, not a youth, but a mental health first aid trainer. And she's delivered the training, I think 4 times during COVID, but she's been doing it online, and they only let you train 10 people at a time. And it just feels so pointless. You know, it's like to take it like that amount of time out of the clinical director's out of the clinic that is overwhelmed at all times, and you're only reaching 10 people. And then like if someone doesn't show up, you're like, oh my God, this is a huge investment and a cost, and it's such a waste. So it's great that you guys can do some online ones to get more people in there.
I'm going to be doing the QPR training at the Boys and Girls Club, the Wakeman Boys and Girls Club, 2 in December. We're having to sign up. I've told the director there that maximum of 12 teens, and we'll have a counselor there as well for anyone who needs to, step away, decompress, what have you. But so I'm excited that we've got 2 of those happening. And then we're also going to, also at the Boys and Girls Club later on, probably in January, February of next year, show the movie If They Had Known, which is about mixing prescription drugs and alcohol. And it's an excellent film. I expect to have great discussion with the teens after we show that. So I'm excited about that. So those are some things coming up.
Great. If anyone thinks of anything, and as things come up, just share with the hub and upload to our calendar, and we'll share with everyone. Does anyone have any final questions, comments? All right. Well, great. Thank you so much for coming today, guys. This was a great
Thank you.
I'll send everything.
Thank you.
Follow-up
Thank
email.
you.
And, enjoy your weekend. Happy Friday.
Bye-bye.
Thanks.
Bye.
Thank
Bye.
you. Always awesome. Thank you.